one of the breakthroughs that our group made a couple of years ago was that looking at just routine H&E images and looking at the collagen architecture, specifically looking at the disorder with regard to collagen architecture from H&E images, that we were actually able to find patterns and features, quantitative patterns from the collagen architecture that were associated with clinically relevant outcomes in the context of breast cancer. And in parallel, our group has also demonstrated that looking at quantitative patterns relating to immune architecture, looking at the spatial architecture and the spatial arrangement of immune cells on H&E images, turns out that is separately highly correlated with outcome. And what is really exciting about this work at SITC is the fact that we've taken this biomarker with collagen that previously was demonstrated to be important in the context of breast cancer, and looked at also the combination of those features with the immune architecture, which we've separately demonstrated previously, in fact, at a SITC meeting, as well as in the Journal of Immunotherapy, that those architectural features of the immune milieu on H&E images is strongly associated with clinically relevant outcomes in gynecologic cancers. We've actually brought those two different biomarkers together and demonstrated that the combination of these biomarkers actually better predicts response to immunotherapy in the context of gynecologic cancer. So we're really excited because there are a couple of things that are really important here. One, the fact that these biomarkers we're talking about are really tethered back to the pathobiology of the disease. They're intuitive, they're interpretable. And secondly, the fact that we could take these two separate classes of biomarkers, that we could meld them together and demonstrate that in tandem, that the ability to predict response and clinically meaningful outcomes for these checkpoint blockade-treated gynecologic cancers was improved, I think is very satisfying. And so we're very, very excited about this work.